A growing crisis looms as childhood vaccination rates drop, and many schools are nervously watching the recent public health decisions made by Health and Human Services Secretary Robert F. Kennedy, Jr. This shift in leadership and policy comes at a critical time when communities are already grappling with serious outbreaks of preventable diseases. After the United States experienced its worst measles outbreak in decades this year, schools across the country are intensively preparing for potential disease outbreaks within classrooms. This urgency has only increased after the Centers for Disease Control and Prevention, CDC, ceased recommending COVID-19 vaccines for individuals under 18 years of age. In a dramatic overhaul, Kennedy dismissed all 17 members of the CDC's Vaccine Advisory Committee and has also taken steps to remove the CDC director and other high-ranking experts within HHS. In response, the states of California, Oregon, and Washington have banded together to form a public health alliance aimed at promoting the effectiveness and safety of vaccines. Their governors released a joint statement emphasizing their concerns, saying, "The CDC has turned into a political entity, pushing ideology rather than science, a dangerous path that risks serious health consequences. Our states will not stand by while the well-being of our people is jeopardized." But the nation is clearly divided on this issue. On the other side, Florida has announced plans to end all mandatory vaccine requirements, a move met with strong rhetoric from its Surgeon General, Joseph Ladapo, who described existing mandates as completely wrong and steeped in contempt and control. Currently, Florida's schools require standard immunizations against polio, diphtheria, measles, rubella, pertussis, mumps, tetanus, and other infectious diseases. Similar to requirements nationwide, experts warn that these diverging approaches could have profound consequences. Lawrence Gostin, a respected global health law professor at Georgetown University, predicts three troubling trends: a continued decline in childhood vaccination rates nationwide, expansion of unvaccinated communities, often based on religious exemptions that would become hotspots for outbreaks, and a stark political divide where blue states strongly enforce vaccination while red states loosen requirements, leading to significant gaps in immunization protection. This year's measles outbreak in Texas, largely fueled by unvaccinated individuals, tragically resulted in over 100 hospitalizations and at least 2 child fatalities, underscoring the real-life impact of declining vaccine coverage. A June report from Johns Hopkins University revealed a drop in measles vaccination rates in nearly 80% of U.S. counties following the COVID-19 pandemic, highlighting a concerning national trend. Lynn Nilsson, president of the National Association of School Nurses, shared her perspective from Washington State, a situation likely mirrored nationwide. "Our Department of Health has already issued guidance for schools to prepare because an outbreak isn't a question of if, but when." The latest CDC data for the 2024 to 2025 school year reveals declining vaccination rates among kindergartners, with coverage slipping to 92.1% for the diphtheria, tetanus, and pertussis vaccine, and 92.5% for the measles, mumps, rubella, and polio vaccines. Since herd immunity for measles requires approximately 95% vaccination coverage, these numbers pose a serious public health threat. For school nurses like Nelson, managing immunizations has become an increasingly urgent task during the school year's start. Traditionally, vaccines weren't the main focus early in the academic calendar because most children were already vaccinated. Usually, we'd note the few children who weren't immunized and follow up later. But now, waiting isn't an option, she explained. School nurses are already stretched thin, juggling medication orders, care plans, and training staff for emergencies involving children with chronic conditions. Immunizations have taken a much more central role. Robert F. Kennedy, Jr., a longtime vaccine skeptic, has aggressively shifted vaccine policy since assuming his role at HHS. Notably, His appointed CDC Vaccine Advisory Panel voted to remove thimerosal, a mercury-based preservative used in flu vaccines for about a century, despite a lack of scientific evidence connecting it to harm. Kennedy and some supporters continue to promote unfounded theories linking vaccine components like thimerosal to autism. Under Kennedy's leadership, the federal government has also rescinded the emergency use authorization for COVID-19 vaccines in healthy children and stopped recommending these vaccines for this group. These moves have generated significant backlash. Over 1,000 current and former HHS employees signed a letter urging Kennedy's resignation, accusing him of compromising national health through his controversial decisions, including the firing of the CDC director. The letter called for health policy to be firmly grounded in science instead of politics, warning that Kennedy's direction puts Americans' health at risk, no matter their political beliefs. Kennedy, who is scheduled to testify before the Senate Finance Committee, has maintained that he is not trying to prevent people from accessing vaccines. On the social media platform X, he outlined 4 promises: ending COVID-19 vaccine mandates, ensuring vaccines remain available, especially for vulnerable groups, demanding placebo-controlled trials from vaccine manufacturers, and concluding the COVID-19 public health emergency. Nonetheless, many health experts warn that his actions are accelerating the drop in vaccination rates, putting schools at the front line of potential outbreaks. Paul Offit, a leading vaccine expert at Children's Hospital of Philadelphia, suspects Kennedy's ultimate goal is to make vaccination fully optional, shifting away from strict recommendations to a model of shared clinical decision-making, effectively dismantling school vaccine requirements altogether. This situation raises critical questions. Should vaccine policies prioritize personal choice over collective safety? Can public trust in vaccines be restored amid political dispute and growing misinformation? How will schools and communities cope if vaccine rates continue to fall? There's no easy answer, but the conversation must continue. What do you think? Is it time to rethink vaccine mandates, or should we double down on efforts to keep our children protected through vaccination? Share your thoughts below and join the debate.